Good evening, everyone. Welcome to our special health segment. Today, we're diving into a discussion about JN.1, a new COVID variant. We're joined by Dr. Rajesh Chawla, a senior consultant in respiratory, critical care, and sleep medicine. Welcome, Dr. Chawla.
Thank you, Maitri. It is a pleasure to be here to talk on such an important subject which is of relevance today.
Dr. Chawla, could you start by telling us what the JN.1 virus is?
See, we had COVID-19 since 2020 and we had number of pandemic after that. We are seeing cases of COVID-19 in between, but every now and then the new strains comes because of the mutation, because whenever a virus multiplies, some of the aberrations can occur which are called mutations, and then the virus which comes has a different character. And now which we are talking today is the JN.1, is a new variant of Omicron, and it has a single spike mutation and it spreads very fast. And that is and WHO has also declared it the VOI, that is variant of interest, because as of now it is not causing severe disease, but we don't know really how it is going to behave. So there is a need to monitor and observe these cases.
Thank you for that explanation. Now, how is JN.1 different from other COVID-19 variants?
It is not very different from as I said, it is a single spike mutation, and that's why it spreads very fast, and it is a lineage in the Omicron. So it is not very different, but there is a single spike mutation.
Dr. Chawla, what are the symptoms of JN.1 virus?
See, the symptoms of JN.1 virus are very mild: cough, sore throat, nasal discharge, fatigue, body aches, like any other viral illness. They are not very different. Some of the patient did have diarrhea, some of the patient did have some different symptoms like the eye symptoms, but majority of the patients are having mild viral symptoms of the upper respiratory tract infections we have in the seasons. These are the symptoms in this. Well, some people of course have loss of smell and loss of taste.
That's informative, Dr. Chawla. And how worrisome is this new JN.1 virus?
This virus is not worrisome as of now. It's a very mild disease. It has caused very mild disease, but it can evade people who have been vaccinated. It is not necessary the people who have been vaccinated will not get this infection. They can get infection, but as of now it is not causing serious disease. People who have been vaccinated can get disease, and people with comorbidities, some of them can get severe disease, but it's too early to say. People have died, but it is possible that they might have died because of their primary illness rather than because of this new virus.
Thank you for clarifying. Should people be worried about JN.1?
We should not be worried, as I said. I think it is important to know about the virus, to know about how to take care of this, how to prevent this. So, this virus is diagnosed like any other virus. If you have in the time of when people are getting infections, and if you have symptoms, and the test which can diagnose is the RT-PCR COVID-19, which was used earlier. So it is still valid test for diagnosing COVID-19. And as far as the treatment is concerned, the treatment is rest, fluids, and symptomatic, which could be antihistaminic and the drug which bring down the fever, and most important is rest. And I think as a prevention measure, it is important that people should wear mask. You should not forget. You should keep social distancing. You should hand wash, eat properly. Don't go to a very crowded place if it is really not indicated. And keep on reading the news and be well informed so that you can take appropriate action so that you do not suffer. Everyone does not really require to get tested, but people with comorbidities probably should get tested. And these are the things which can really prevent not only the spread of virus and also, even if you get infection, how to take care of you properly.
Thank you for the advice. Will this new variant affect those who are fully vaccinated?
I told you, it can evade the immunity. So people who have been vaccinated can get infection, but it will be mild infection. Like earlier we had Omicron, which was a mild infection. So probably it's only going to cause a mild infection. But if you've not been vaccinated, please do get vaccinated. If you've not received the booster dose, please do get the booster dose. Keep yourself properly immunized if you really want to avoid the infections and the spread of infections to others. So I think the most important thing is that if you have infection, if you do have even suspected infection and you did not get the test, please do wear mask, because one, you will prevent the spread and it will not cause any member of the family to suffer. And then when the family members suffer, they go out and the other people suffer. So if you have symptoms, the best would be, of course, to get tested. If you're not getting tested and it is really not recommended for mild symptoms, then wear mask and practice the hand wash and other, which are social distancing, and probably isolate yourself for 5 days. You must remember that this virus is infected 1 to 2 days before the symptoms and 5 days after. So it is recommended, suppose you got infection, so you take rest for 5 days. And that is what is recommended, that probably it is not required to retest yourself. After 5 days with a mask you can join back. And there are no food precautions. Normal food can be taken if you have COVID-19. And as I said, eat proper food, balanced diet, and take a lot of fluids and rest. These are the 3 things which will not cause any problem in you.
Thank you, that's reassuring. Are there any vaccines specifically for JN.1?
There are no separate vaccines for this. We have the same vaccines which are available now, and as of now there is no vaccine which is included the JN.1 virus in the content of the vaccines.
Dr. Chawla, thank you so much for joining us today and for your insightful explanations. It's been incredibly informative. Any final message for our viewers?
I want to say, I've been saying all through my talk again and again, I think it is important whenever you hear in the news that the infection is occurring around in the country, in the city, in your locality, in your house, the most important is COVID appropriate behavior. Wash your hands, wear mask, keep social distancing. If in the house, go into the separate room. These 3 things, eat properly, take plenty of fluids, and you will not suffer from this disease. Thank you.
Thank you to our viewers. We appreciate you tuning in for this important discussion. Your awareness and actions are crucial in navigating this new health challenge. Remember, staying informed and following health guidelines are key in keeping ourselves and our communities safe.